We're all in our places with bright, shining faces. It's been a few weeks since everyone has been here together. Thank you very much for being here. Thank you for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We've got Dr. David Jetmore, who last week was here.
That's right.
Christine Stinson was there. And Dr. Huth was there.
I'm still
so
in
I
my
guess I
same
was
place.
the one that was missing. But it's been a few weeks since we've all been together, gentlemen. It's very good to see you again.
Good to be here.
Great to be here.
We always start with the week that was. I'm going to preempt that just slightly, if that's okay.
Sure.
Because just about 20 or so minutes ago, what came into my email box, and I thought you all might be aware and had seen that, but you had not. It seems that Governor Holcomb has extended the public health emergency. It was scheduled to end on June 1st.
Yeah.
It has been extended another 30 days to July 1, and I'll just read some of his language if that's okay. As of this date, and that's today, of this executive order, the virus has now spread to every county throughout Indiana with over 741,000 confirmed cases, over 13,100 deaths. The vaccination programs and efforts continue with nearly 2.5 million Hoosiers fully vaccinated out of 5.7 million eligible. Critically, he says, 99.3% of new COVID-19 cases are with unvaccinated persons. And I'll let you all kind of speak to that in just a little bit. The declaration of a public health emergency set forth in the original order of 2002 is therefore renewed for an additional 30 days beyond its current expiration date of May 31st. This renewal of the COVID-19 public health emergency shall become effective June 1st, 2021, and now expire on July 1, 2021, until further notice. From a public health standpoint, Dr. Jetmore, what does all that mean?
Well, I think it speaks to the fact that the rate of COVID positivity in Indiana is still very low. The governor feels that the population is getting a lot of protection from people who are vaccinated. About 40% of Hoosiers are vaccinated now. But you notice he holds in abeyance what he's going to do on July the 1st. I'm sure if rates go up, then he'll extend it, he'll liberalize it, or he'll become more conservative with directives to the public if it goes the other direction. So we're headed in the right direction. We're headed here because people are getting vaccinated, but we're at the point where we're getting a lot of vaccine resistance, as we talked about last week, and that's not changed all over the state. Some states have been really successful and gotten 70% of their populace vaccinated. I think in the United States overall it's 51%. But I think as this unfolds, you're going to see pockets of highly vaccinated people, and then pockets where it's a very low vaccination rate. And I think you'll see different levels of diseases depending on what the vaccination rate is. I think it's significant, the fact that people who are getting COVID, 99.3% of those people are unvaccinated people, which speaks to the fact that it's dangerous not to be vaccinated, and to the fact that if you are vaccinated, it gives you very, very good protection.
He also signed a second executive order, 2115, that adjusts or lifts some of the requirements, including removing the mask mandate while in state facilities, except for anyone inside of state government congregate facilities such as prisons, state hospitals, Indiana Veterans Home, and the Indiana Law Enforcement Academy. Masks are also still required inside COVID testing and vaccination clinics, continuing the face mask requirement inside Indiana schools through June 30th. Face coverings are not required outdoors or on school grounds. Starting July 1, local school boards will determine what measures or restrictions are needed in their local schools regarding the spread of COVID-19. Directing Hoosiers to follow the CDC guidance for fully vaccinated and unvaccinated people regarding wearing masks or protective measures, and he also did something about waiving penalties for state income taxes. But that will be interesting. You talk about what's going on. There'll be a hodgepodge of what you can and what you can't do in various schools now, depending on what the local school board says.
Well, the governor and the county kind of parted companies on the idea of whether or not to wear masks in public buildings. We're continuing to require masks in our public buildings here in Wayne County, and the rationale for that is the employees, almost all are vaccinated, so they're safe, but there are 100 to 150 visitors that come into that building each day, and our concern is that they would infect one another. We have no way really of knowing who's vaccinated and who isn't. Mm-hmm. So that was our rationale in continuing having masking in public buildings here in Wayne County.
Are you finding those numbers to be right? What are you all seeing? And we'll get into some of the statistics a little bit later on. But what have you found at Reed as far as people coming in still having COVID, vaccinated or unvaccinated?
Yeah, I think, first of all, I want to give kudos to Dr. Jetmore. He was maybe the first in our company here, to our little group of friends, that was talking about that 99.3% statistic that the governor used in the executive order today. So you're, as usual, Dr. Jetmore's kind of ahead of the curve. The thing I'm a little bit uncomfortable with is sort of the overall gestalt that somehow we're kind of over the pandemic or nearly over it. But the reality is it's still out there. And people are getting infected, people are getting sick, and when we get to the statistical portion of the program, I'll make that point in several ways. We can see that our numbers are really kind of more moving sideways than they are down. And we're certainly still seeing cases at Reed and some really tough cases. People, that I think is, to me, kind of unavoidable. They were avoidable problems, so we still have work to do to get all the right people, especially those who are at high risk, vaccinated. And when we look at the statistics, about 75% of those over the age of 70 have gotten vaccinated, and that appears to be stable, not going any higher. That's as high as it gets. So to me, that kind of defines the upper bound, but when you get down to the below 60 or below 70, below 50, there are lots of people in those age groups who have underlying medical problems and risk factors for severe coronavirus disease, and they're not getting vaccinated at the same rate. I mean, they're probably averaging between the 50 and 60 age groups, 50 to 70 age groups, averaging around 50%. That's where a lot of the disease is now, is in those age groups, a severe disease, severe enough to be in the hospital. And so we are seeing a shift, really, in the age groups of people who are hospitalized, and it's really kind of striking. And I will show that, demonstrate that graphically when we get to that portion of the program. And, to me, it's a little of a crying shame because it's, the vaccines really appear to be very good, and these things appear to be almost completely preventable. Yet here we are with people suffering from severe disease, unnecessarily, in my mind. But, and I think where we're at with the vaccinations is that all the early adopters all kind of got through it ages ago. Then we have the very resistant people are going to be really hard to make inroads into. And in this part of the state, it appears to be about 25% of people are in that group. I'm guessing. That's higher than in the national statistics, which I was just reading some this morning. a new poll that showed that 13% of Americans are highly resistant to the idea of getting vaccinated, and I think that's a much higher percentage here, probably twice that. That's unfortunate. But then we have people who are still in the middle, unsure. They're not scientifically trained, and there's so much information for and against, and whether the arguments against or for are scientifically based and justified or not is hard for them to discern. And so they're kind of stuck in neutral, not really sure what to do. And a lot of those folks are younger, and then you have they're factoring in also the known fact that in the youngest age groups, your chance of dying from coronavirus disease is very small. But that doesn't mean you can't have problems, enduring problems for it. And I think I quoted from a study that amongst adults, at any rate, who have recovered from coronavirus disease, 50% still had some degree of symptoms, some kind of lingering symptom 4 months on. And that can be a variety of things. So that group in the middle who kind of aren't sure what to make of it all and whatnot, those are the ones we have to convince, and that's a very one-to-one kind of thing. It's hard to reach them just with blanket advertising. They have to kind of have to be approached one by one by somebody knowledgeable and understanding and non-judgmental who will help them to work through their concerns.
Good luck with that. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. We appreciate you joining us on this Friday afternoon. One of the big conversations over the last few weeks has been the age at which you can get the vaccine. The number has been dropping. I believe it is 12 and above. Is that where we are still? We wanted to get some information on that, so we've reached out to Dr. William Black from Pediatrics and Internal Medicine. He has been nice enough to join us, and as I normally do when another doctor joins the conversation, I'm going to turn this over to the doctors, and I'm stepping out. But Dr. Black, thank you very much for being with us. We really appreciate the time.
Good. Can you hear me?
We can.
Everything's good?
Yes. Sounds great.
Good. Thanks for having me. Eric, it's nice to hear from you. Tom, I get to talk to you quite a bit. And David, it's always fun when I get to talk to Dr. Jetmore, so I'm glad to join.
I'm sure Dave will jump in with some cowboy philosophisms at some point during the program. He's our cowboy philosopher. Bill, I wanted to talk to you about a couple things. I know that, in your practice where you deal with lots of kids, there's a little bit more of what I call a vaccine centric culture kind of in a pediatrics practice. I don't know if you would agree with that or not, but I think in my practice, which was all adults, it was, we talked about it and tried to work on it, but it wasn't quite the same focus on it as you have with kids. And I'm just wondering about, now that we are making the Pfizer vaccine available down to age 12, how is that conversation going when you talk about that in the context of other vaccinations?
It's a work in progress, just like COVID has been. Everything keeps changing. But so far, it's gone pretty well. I think that a number of thoughts, really, but your comment about the middle of the road people, I think they just need to hear some more advice from medical personnel that this is safe, and many parents are looking for that from their pediatricians or family practice docs the same way. There's not one age group that hasn't been affected by COVID somehow. And for those that are watching, that are parents or grandparents, I mean, this last school year has just been topsy-turvy as far as education and the ability to participate in extracurricular activities. And I think we've seen a lot of problems with this, a lot of anxiety in children and teenagers that we didn't expect. Again, another unexpected problem with COVID. With that said, I think everybody is looking for ways to get back to what we consider more normal. And clearly one of those ways is vaccination. Most parents are very good about vaccinating their children, probably more in tune about vaccinating their children than themselves sometimes. And many of those are mandates by the state anyway to go into school. So we're very much proactive with vaccinations in general. And I would say that we are approaching the COVID vaccine very similarly. The medical data, if you will, and again, I know sometimes that's hard for people to get to accurately anyway, is overwhelmingly safe for the age group that has been approved, 12 to 16. With Reed's help, and especially your help, Tom, this week we have started to be able to give the vaccine within our office. And I think that's good. I think people trust us because they get their vaccines here anyway. And it's just another avenue for convenience. And we're with you, I guess, in that we want to vaccinate the population. So I kind of answered that in many ways, but that was a start anyway.
That was perfect. And you mentioned the effort that we're experimenting and Dr. Black's office, he and his partners, on how can we best do COVID-19 vaccine there. And so far, it's really just kind of on what I call a drive-by or vaccine-by basis. They're there for other reasons. You were saying, hey, would you consider getting the vaccine? But interestingly, you mentioned, Bill, that that people want to hear from their own doctors, and that is borne out in national polling that a certain proportion of people are going to be more likely to view vaccination positively if their own doctor recommends it specifically to them. It's not just the medical establishment saying so on a talk show. It's my doctor told me I really should get vaccinated. That a lot of people are saying that would really sway them. And so that's kind of the idea that we're taking into the office to get your teammates to suggest it specifically. But interestingly, you also mentioned it ties into something that we've noticed a little effect. I was told this week that a few people have called the office asking to be scheduled to get it at your office. They could get it today for their kids at Kuhlman Center. They could get it at any of the urgent cares or at Ready Care at Meyer, yet they want to get it at your office on a scheduled basis and want to come specifically for the shot, which we have not set up yet. Mm-hmm. I said we were just doing a kind of like a drive-by basis, a walk-by basis. They're there for some other reason. So we're actually going to implement a scheduled vaccine clinic process there. And it's a little bit complicated because of the interfaces with the state's vaccine management information system and so forth. So there are certain challenges we have to overcome, but we're going to put some effort into that. So I'm hoping that this can work as a model to take to the other primary care offices in particular. But I wanted to ask you specifically about this idea that saying something to your patients or to their parents, do you get the sense that actually is more engaging to them than any messaging Reed does as a marketing effort or that they can otherwise see on TV and so forth?
I think it certainly has the potential and is true for a number of people. I mean, anybody that goes to a family physician or pediatrician, internist, but has a relationship and has trusted that person for years and perhaps gotten their family members through some type of illness or other issue, absolutely. I mean, I think there still is that personal relationship component to medicine, at least for many of the primary care offices. And so I think, Tom, again, it's just another avenue to educate people and to hopefully increase the overall percentage of vaccinations. But the simple answer to that question is yes.
Well, I wanted to ask you one more question quickly, and I think Dave wants to jump in too, so I'll let him do that. But I wanted to ask you about multi-system inflammatory syndrome in children. I get the question periodically, have we had any cases of that around here? I think the state has recorded a number in the around 70 cases of it in the state. Are you aware of any of that particular complication from COVID-19 infection occurring amongst the pediatric population locally?
No, I'm not. If a child really gets ill to the point we're worried about that, they would not be kept at Reed just because we don't have the pediatric specialist, ICU. So if there's any concern about that, they would probably be transferred to a tertiary care center such as Riley or Peyton Manning. But for the most part, we haven't really had that. However, I do want to say this, and you mentioned, younger people still, even though it's less frequent than those age 70 or more, but there are a number of pediatric cases that have gotten very serious. We have Riley Cardiology has an outreach clinic through our office, and I was talking to one of the cardiologists recently, and they've had some really sick teenagers, really sick, on ventilators that have affected both their lungs and some of the cardiomyopathies or the heart weakening that sometimes goes along with COVID vaccine. So we don't hear about it as much, and that's a good thing. And thank the Lord that it's not affecting the young people like it did the very elderly or across the population. But with that said, COVID can reach out to the young people and get them very, very sick.
Yeah.
Bill, Pfizer's doing their clinical trials on children from ages 6 months through age 11, and the preliminary results look fantastic in terms of efficacy. Approaching 100%, even better than the efficacy they've had in adults. They're doing this in cohorts of, I think, 6 months to 5 years, then 5 to, 6 months to 2, 2 to 5, and 5 to 11. And there's talk that they'll ask the FDA for emergency approval in September, which is close to the start of the school year, and maybe have vaccinations ready in October. I was encouraged when you said children or parents are more concerned about vaccinating their children oftentimes than themselves. Have people been asking ahead? Have people been asking you, when can I get my child vaccinated? Does there seem to be some enthusiasm and interest in that prospect?
Yes. I think everybody's, just like all of us have done through this whole pandemic, it's kind of watchful, hopeful waiting, just like what you've done, David, with the health department. Much of this is following the CDC guidelines and what the medical experts tell us. But yes, I think there's a lot of, I'll say, enthusiasm for even the younger people. And you said, as you mentioned, their robust response is very encouraging, and kids have a rather robust immune system to begin with. But I think if it's deemed safe by those that recommend the vaccine and the standard guidelines, I guarantee you that our office will be a promoter of getting children vaccinated as well, with the end goal to end all of this mess and get us back to what we considered a more normal lifestyle.
Dr. Black, we appreciate your time today. Thank you for joining us. Hopefully, as we get closer to the start of school, you'll be able to join us again, because I'm sure as the ages go down from 12 to whatever that bottom line number will be, there will be a lot of parents that have an interest in finding out your thoughts as to whether the vaccine is safe, where it can be gotten, when it can be gotten, and that type of thing. Before we let you go, is there anything that you would like to say to the community, those people that you haven't had a chance to see but that you've had a relationship with, as far as particularly children, getting them vaccinated?
I would say I would strongly encourage anybody and all members of family that are eligible to get vaccinated. It's safe. It's a game of chances with COVID, and I think it's good for the individual, and I think it's good for the family, and I really think it's good for population health. I don't have any reservation about vaccinating for COVID from the approved ages 12 on up. How's that?
Okay. Dr. William Black, thank you very much. We appreciate the time.
Okay. Thank you, gentlemen. Have a good day.
Thank you. You're watching Ask the Doctors on Whitewater Community Television's WGTV, Channel 11, WCTV, Channel 21, streaming on Facebook Live. We are taking your questions for the doctors on our Facebook page, as well as on Twitter at WCTV Info. Talk about what you're hearing as far as, and you mentioned the clinical trials for children. How fast is that moving? Have you heard any hiccups with that at all? Particularly when you're getting to the very young. I know that there might be some people wondering, are we overdoing this, trying to vaccinate kids for this that are 6 months, a year old? Is that kind of an overkill situation in some ways?
Well, we've referred many times to the if you simply look at the death rates from COVID-19 infection, they're very, very low the younger that you get. But that's not the whole picture. And, so there really are two things. Could there be long-term consequences to having COVID-19 infection that even if it doesn't kill you, a 1-year-old getting COVID-19 has got an awfully long lifespan to kind of live with whatever the after effects are that we don't really fully understand. I think there's so many unknowns about that. And there are indications that there can be long-lasting consequences. So I think it's really going to be more about, in terms of the personal protection of the child, it's going to be about preventing whatever the long-term effects could be. But then there is also the possibility of children, even small children, transmitting the virus to other people who are more at risk from the severe immediate consequences of the disease, grandparents or neighbors or friends, family, whatever, who are in high-risk groups. And so it really is kind of, in my mind, kind of a two-pronged thing. Protect the child from the long-term effects, but also protect others from, accidental transmission of disease. Admittedly, the transmission seems to be lower under age 10, but it's not non-existent. And so it's a thing that I think that they have done some studies that, amongst teachers actually, that teachers who get infected are very unlikely to get infected in a classroom, but they are likely to get infected in a home, and a high percentage of the time, the index case in the home is a child. So, those are the considerations, I think. But Dave might have other impressions.
I have to echo what you said, Tom. When you get vaccinated, you're getting vaccinated to protect yourself, but you're also protecting your family, and you're also protecting society in general. If that 6-month-old has one of the 25% of 75-year-old plus grandparents that have not been vaccinated, that could prevent an infection. And we need this cohort of children and adolescents. I think I heard that there were 17 million adolescents in the United States. We need that cohort to be vaccinated in order to get closer toward herd immunity to help exterminate transmission of this virus and stop mutations which occur when someone's infected.
Dr. Jetmore, talk to us about where we are, the most recent numbers for Wayne County, and while you're doing that, I'm going to ask the control room to pull up the state map. We've got Steve Bonwig and Brandon Gentry running the control room today. They're going to pull up the state map. We haven't had a chance to look at that today to see where that is. I turned around, it was blue 6 weeks ago, almost from top to bottom. Various other colors have begun to creep in. What are we seeing here in Wayne County as far as our positivity rate? Are we staying about the same?
It's very low. It's at 2%. That compares to a state rate of 4.8%. So that's about as low as it's ever been since the pandemic started. Which is a good thing and a bad thing. It's a good thing in that we have a very low amount of COVID, and it's a bad thing in that I think it makes some people say, well, why should I get vaccinated? Very little COVID in the community, I'm pretty safe. But like I said earlier, you get vaccinated not just for yourself, but for society as a whole. And so we need to, I hate to keep plugging vaccination rates, but I think that's the one tool in our tool chest that will really do more than anything to put an end to this pandemic.
Well, and that was the question at the beginning. I mean, the question at the beginning was, how do we get out of this? You know, nobody wants to shut down a business. Nobody wants, everybody wants kids back in school full time. People want to be back at work regularly. They want their lives back at this point. And the question became, how do we get out of it? You all are saying, you all at this moment, a year and 15 months, whatever it is, are saying this is how we get out of it. Not just for us, but around the world. And I know, Dr. Huth, you've been following this from the beginning. There have been the ups and downs in other parts of the world. Yeah. There's still this back and forth as to whether they're going to have the Olympics in 6 months. Right. What are you seeing, and are you still even following the trends around the world and where they're having particular issues?
I think this is part of the problem for us in the U.S. is that we can do everything we can to kind of suppress the rates in the U.S., but there are entry points back into the U.S. of variants and just kind of the resurgence of disease, and that was the kind of the problem that India had. India's come on, we actually have just come off of the worst surge of cases worldwide. We all think about November, December, January as the tough months for the U.S. and in this part of the country, and that's not untrue. But because it hasn't really impacted us so much directly, we totally forget that India had a really terrible wave that peaked about 3 weeks ago, and 3-4 weeks ago, and the total peak for the world as a whole was higher than it was in the winter. So in effect, the world has just come off of the worst peak so far, and that's like number 4 worldwide. Could there be more peaks? There could be. We think back to the Spanish flu epidemic, 1918. We talk about it being the 1918 epidemic. Well, that's when it started, and it lasted the better part of 3 years, with multiple waves. Now things are much, much different now in many ways. We understand disease better. We have vaccines. We understand more about infection control and so forth. But that's not. Those are the levers we can, turn. But and they have an impact. But it's not the whole story on how epidemic viruses like this come and go. So the U.S. will always be at risk if we're having surges in other parts of the world because there's so much international travel. As much as we try to suppress the international travel, it gets in anyway. And so right now, Australia is starting to have a surge. And I think I heard that Melbourne, Australia is going on lockdown or went on lockdown like last night. Malaysia is having another surge. So there are some, and those countries kind of form part of the Pacific Rim. So that part of the world, the Eastern Pacific part of the world, is now starting to have more of an impact of surges. But we get a little bit insulated in our thought process and think about how low things are here. But when you think about it more broadly, you can see that there'll be more opportunities to have resurgence. And it's really going to impact those who are unvaccinated the worst. Or it's going to impact them the worst. That's what happened in India. They had a wave last summer that, in retrospect, looks tiny compared to what they just went through. But at the time, they thought that was their wave. So after that, and during it, people were great about distancing and masking and hygiene, and there weren't vaccines then, but those are the things that they did. And after that, they thought, well, we're over it. We don't have to worry about it anymore. And so all the infection control mechanisms kind of went by the wayside, and there was very little uptake of vaccine in India prior to the start of their wave. And I think still they've only got about 2 or 3% of the population vaccinated. It's a massive population, going on 2 billion people. But their case counts and death counts are probably vastly undercounted, and they will, at the end of this, I think, have the most cases and deaths worldwide, even exceeding the U.S. By a good margin, I predict, when it's all said and done. And that's not even factoring in additional waves. So I think we have to be careful, but I feel a little bit like, Chicken Little kind of crying that the sky is falling when everything appears to be sunny and calm. But I just think we can't really let our guard down, and we have to continue to make efforts to get more people vaccinated. That is the way to prevent the development of new variants, as an example. Because if we don't have people who are susceptible, then the variants can't develop.
If you think of the world as a big house, and it is, there's so much communication of people, and with that communication of disease, it's sort of like, we're sitting here in the living room and everything's fine. We shouldn't worry, even though the dining room and 2 of the bedrooms are on fire. We're going to be affected by this, and we need to get vaccinated ourselves. And I think in the long run, we're going to have to help other countries get vaccinated.
Yeah, and we've certainly got plenty of vaccine to do it. Right now, actually, there's a looming problem that amongst these vaccines don't last forever. They have expiration dates. And there is an expiration date looming for a lot of doses of Pfizer. It's not something that's talked about very frequently, but in June, there will be millions of doses of Pfizer that will be expiring, probably unused, because it's hard to find takers for it all at this point. And so, to your point, to me, they ought to be packing those things up right now to go to Malaysia and Australia and India or wherever it's needed, in places in Africa. And I think, the African continent has not been very much impacted by COVID so far. Either that means there are factors there that we don't understand about why they're not being impacted, or their time is coming. One of those two things. So to me, we ought to be packing up all our excess vaccine and shipping it off to places in the world that can use it. That protects us. That's kind of what I've just been saying about how we don't live on an island, really. Whatever happens in other parts of the world are going to come back to affect us.
Travel is up all over right now. A lot of it domestically, but eventually it will go back to being international. They're trying to get the cruise lines back up and moving. People want to do that again. And that was a nightmare at the very beginning. So I know that they're trying to avoid that. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook. We are taking your questions at WCTV Info, as well as on our Facebook page. Let's go to our first question. Vaccination has slowed. Is that a surprise when the health department only vaccinates 3 days a week?
Well, our vaccination schedule is driven by demand, and you couldn't justify giving vaccinations 3 days a week for an extended time when we had so few people coming in to get vaccinated. So if we had the demand, we would vaccinate 6 days a week, and would love to do that. We would vaccinate until our hands bled, but there just isn't the demand for the vaccine right now, and that's why those vaccination hours have been constricted.
Yeah, it's the same thing for Reed. I mean, the Kuhlman Center, we will continue to offer mass vaccinations, but starting yesterday, was today the first day? Yeah, Thursday was yesterday, right? Yesterday was the first day where we're cutting back to 3 half-days a week for the foreseeable future unless the demand changes.
Still at the Kuhlman
It's not
Center?
available. What's that?
Still at the Coleman Center?
Yeah.
3 half-days?
It's just the Kuhlman Center's 3 half-days a week starting yesterday, Thursday, Friday, Saturday. We hope that those are hours that are convenient for people. We calculated it so there's enough vaccine slots available for about 3 times what we thought our demand was going to be. So there's plenty of room for demand to expand into. And if we get signals that, more hours would be good, then that's exactly what we'll do. But that doesn't mean vaccine's not available, which is really the point I want to make. We are offering vaccine through our urgent cares on a scheduled basis at the Ready Care. I've mentioned those previously as well. And we're looking to get it into the doctor's offices. So I don't think there's a problem with access, even with the reduction of the mass vaccine site schedules. And I think we would see that if our schedules were full or we were getting phone calls, hey, I want to get vaccinated, but you don't offer them. I mean, there are communication means that people can let us know if those hours don't work and we need to do something different. And that's not what we're hearing from people.
And I think the health department's made it clear that you all will go places for as few as 15, 20 people. You all will go and vaccinate.
We want to vaccinate people, and I don't want the person who asked that question to think that people aren't getting vaccinated because they just don't have as many opportunities. That's not the case. You can schedule a vaccination at rshot.in.gov, or you can just drop by anytime before 3:30 and walk in, and you'll get vaccinated and be on your way. But you won't have, there are just very few people that are getting vaccinated. You're not going to be jostling through a large crowd standing in line waiting to get vaccinated.
Okay. Let's go to our next question. Regarding the new Indian COVID variant, I heard on TV that the Pfizer vaccine is about 88% effective against the variant, but they didn't mention Moderna and how effective it might be.
Yeah,
Any
that's right.
update?
This Indian wave that we just talked about appears to have been driven by a variant that's related to the UK variant, but I think they're calling this one B16171 or something like that. Pfizer has been tested specifically on it, and that's why we have those numbers. Moderna, I'm sure, is in the process of validating that for their vaccine. But since they're, in my mind, Pfizer and Moderna are more or less generic equivalents of each other, they work the same way, use the same technology, I think we can expect that Moderna will be very, very similar, because in all other side-by-side testing, they've been pretty much identical. So I think we can expect Moderna will be the same way.
Okay. We're going to get one more and then go to your numbers for this week. So if we've got one more question, we've got about 12, 13 minutes left in this week's program. I have one vaccinated kid and one who isn't. Is it safe to let my teenager vaccinated be part of a gathering? Can they bring COVID home to their sibling?
Well, here's the way I look at it. Some of the testing that still needs to be done is exactly what does immunity mean? Does it mean that you can't get the virus, period, or what? I mean, the phase 3 testing for the Pfizer and Moderna vaccines, just to take those examples, was that they were 95% effective at reducing the rate of severe coronavirus disease. Now, further testing has shown that probably what happens is it reduces the likelihood of getting infected, period, though some people still can. And it reduces, and if you get infected, it reduces the likelihood of having severe disease. And if you get severe disease, it reduces the likelihood of dying from it. So it kind of moves everything down a notch in a way. I think that's probably essentially what will be validated. So the specific question of my teenager who's been vaccinated, can he get it and carry and bring it home? It's not impossible, but it's unlikely. And I think Dr. Jetmore referred earlier to, I think something else that we're going to learn is that in younger people with sort of more robust immune reactions, immune system, reaction to getting vaccinated, they're probably going to be more likely to generate enough immunity to just not get infected, period. And so I think, you'll have to use the questioner will have to use their own judgment of what to do with these two kids. If possible, get the other one vaccinated when you can. Maybe it's a younger kid, and I hope that's in the plan. But I think the likelihood is you're doing everything you can with this teenager, having that one vaccinated, and but still, they should still try to be careful in situations where there's lots of gatherings and that kind of thing.
Thank you for watching Ask the Doctors this week.
Mm-hmm. I sort of do.
Okay.
I don't disagree with you. I think it's always good to be cautious.
Oh, come on, disagree with him. Let's have some fun.
I think a teenager that's been vaccinated is very unlikely to contact the disease and very unlikely to be a carrier with enough virus to infect the sibling.
Right.
And I think we're kind of in agreement on that.
I think we are.
Okay. Well, we've got a couple more questions we're going to try to get to, but first we're going to turn to Dr. Huth
I
take
actually
a look
brought
at,
a lot of graphics today. We'll
I was
just
going to
cut
say,
through
you brought a
super
couple of
fast
new
if we
graphics,
just
I
want to.
think.
That's the county data, and you know what? That did not get updated with the latest couple of weeks. But the point here is the county cases are just kind of bumping along sideways, sometimes a little up, sometimes a little down. If you want to go to the next one, the next one will be the Reed-specific data. And there you will see kind of a similar pattern if we just focus on the last few weeks, way off to the right. I did want to make a point that we have had at least one person on a ventilator each of the last 6 weeks, and that's actually a change. We had gone probably 7 or 8 weeks where we might have occasionally had somebody for a little bit, but we had a lot of weeks where there were none at all. Mm-hmm. I did want to make the point that I have seen a shift in sort of the age groups and conditions or the situations in which people are in the hospital, particularly on ventilator. In the last 5 or 6 weeks, we've had 5 patients on ventilators. 4 of them passed away. Now, here's the difference. The commonalities they have is they're all between the ages of about 57 and 65. So they're not the 70 and 80-year-olds.
Right.
They are all obese, diabetes, and unvaccinated.
That's the one thing that everybody on that graph has in common. Every single person on that graph has not been vaccinated.
Yeah, I think we can probably. Well, it's amazingly hard to figure out whether everybody's been vaccinated who's in the hospital. We did a little field testing, going back and looking at cases for a couple of weeks, and I could find one person who was partially vaccinated, who was in the hospital. But point is, we are seeing a shift. Younger folks, and they have this commonality of diabetes, obesity, no vaccine. And that really is very regrettable and unnecessary, because if you look at the very next graphic, which is age-related. The upper part is the age-related case fatality rate. We can see that and this is something we've shown before. The case fatality rates are much higher, particularly when you get above age 80, but certainly above age 70. It's in that age 50 to 60, 60 to 70, where these cases are that I was just talking about. The 5 on ventilator, 4 passed away. Those are significant case fatality rates, actually. And if you look at the lower graph on that same page, you can see that this is the vaccination rates in the population by age groupings, and we can see that in the 50 to 59 and 60 to 69, we're only talking about on average about 50% of those folks in those age groups have been vaccinated. And so I think this is where our biggest vulnerability is. They have significant vulnerability to severe disease and death, and they're not getting vaccinated as highly as they could be, especially those who carry risk factors for severe disease, particularly obesity and diabetes. So that was the point I wanted to make, and we have a lot of work to do with those. The next page.
And this area has a high rate of things that you're speaking about.
Diabetes
those
and
conditions,
obesity, absolutely. The left side, these are the vaccine start rates, and RSA is Reed Service Area. We can see it's significantly below. The Reed Service Area is all the counties surrounding Wayne County, including 2 in Ohio. And that's comparing to the Indiana current start rates in Ohio and U.S., and we're still significantly behind, and it's not really changing very fast. The right side of that is the percentages of the population that have completed the vaccination series, a little bit tighter grouping, but it's really the same point. If you go on to I think this is the last one is next.
I'd like to know how much Ohio's numbers have gone up since they started offering that $1
about
million
to show
a
you.
week
That's
for
what I'm
5
showing
weeks.
you next.
Okay.
You can look at this is a curve of actually the daily vaccination numbers in Indiana is the upper part, and we can see that there's been a continued downtrend even in the last couple of periods. That's off far to the right. Below that is the Ohio one, and we can see that there's a bump in the last few periods related to the Vax-A-Millions lottery, obviously. But I would note the very last set of bars, last 4 or 5 bars there, are the current week in progress, and it's not as high. So it looks like the pattern that's forming is there was a little bump for a couple weeks, and now it's gone back kind of to the low numbers, despite the fact that they're still doing more lotteries.
Right.
So I think a lot of the people who really want to get on the lottery thing have gone and done it, and now they're kind of done. You know what I'm saying? Mm-hmm. So it'll be interesting to see what happens with that going forward.
Okay. We're in our last few minutes of Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We're going to try to get a couple more questions in, so let's go with the next one up. Should I buy an N95 mask for my unvaccinated child, too young to be vaccinated, since the mask mandate has been lifted? Are they still in short supply?
Well, N95 masks are the most effective masks you can get. But having said that, and I'm speaking personally now as a surgeon, I don't wear an N95 mask when I operate on patients that have COVID because I don't feel comfortable. I'm not getting enough free movement of air when I breathe in and out. And when I'm operating, I want to think about my patient and not whether or not I can breathe. I think it would be very difficult for an active child to wear a mask like an N95 mask. And whoever posed this question loves their children and wants to do the very best they can for their children to protect them as a parent. But I think simply putting a regular face covering on a child is sufficient. I think you've done your duty.
I totally
What are your
agree.
thoughts, Tom?
And I want to share your sentiment. The person who asked this is asking a smart question, and obviously is a very admirable parent, so good on you. However, I guess what I would say is N95s sound good in the abstract, but they can be difficult to manage for you mentioned that they can be harder to breathe through, and they absolutely are. They're hard to wear for long periods of time, and they have to be properly fitted for them to work maximally. To be better than like a surgical mask, they actually have to be fitted in it particularly. And so there are a lot of barriers to correct use. Therefore, I would not spend the time or money on getting an N95 for this child. What I would do is just have either use surgical mask or a good cloth-based mask. Really, the most important thing about it is that there be if it's a cloth mask, that it be at least a couple plies of cotton-based material. And there also has to be as good a seal as you can get all over the nose. Ideally has the wire in the bridge of the nose, can get a seal around the nose and along the sides. It's really about the sealing that up as much as you can so that the air movement is through the mask and not around the edges. That's been proven scientifically, is that cloth-based masks that have those characteristics actually perform really well. Not quite as well as a well-fitted surgical mask, but really very well. And that is probably going to be the thing that's going to be more tolerable to a child, I would think. Anyway.
Gentlemen, I think we're going to have to leave it there. We've left a few questions on the table. We'll bring those up first next week. Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health, thank you very much for the time. My pleasure. Dr. David Jetmore, Wayne County Health Officer, once again, always good to see you. Got a little rainy and a little chilly. You were looking like good motorcycle weather out there for a few days.
Yeah, it was for a few days, but not today.
Wow, one of those. I'm sorry to hear that. A couple of things we want to remind you of. If you are in need of affordable health insurance, there is a special enrollment period going on right now. You can find a few places to do that in Richmond, downtown, Reed Urgent Care, Reed Campus, and also in Connorsville. Put this up earlier. Want to remind you the COVID-19 vaccinations are still available for those 12 and older. The only ones that 12 to 16 or 18 can get is Pfizer. What's the
That's
age
right.
range?
It's Pfizer.
It's 12 to 18?
Yes.
Well,
Okay.
Well,
16.
16 to 18, I think. With Moderna, you have to be 18 or older.
Okay.
But 16-year-olds can take the Pfizer vaccine.
Yeah, you're right.
Okay.
12 to 18.
That's
Pfizer.
being offered Wayne County Health Department Tuesday through Thursday.
And you
9
can.
a.m.
We
to
have
4
all three.
p.m.
Sorry to interrupt, but we
Yep,
have
no
all
problem.
three vaccines, and you can choose whatever vaccine you want.
Okay, so you can get the Moderna, the Johnson & Johnson, or the Pfizer.
That's right.
Ourshot.in.gov. Virtual color fit run for City Fit is taking place June 1st through the 30th. You can register at eventbrite.com for more information on that. Thank you for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11. If you missed any of this program, it will be available later on this evening, also on our video on demand site. Thank you for watching. As always, I wish you well. Have a great weekend.